Hello, and welcome to the Digital Health Legislation and Advocacy session. I'm Jeff Coughlin, Senior Government Relations Director at HIMSS. Very happy to be here today to speak to you a little bit about some of the things that are happening on the advocacy front in California, as well as on a national perspective. So first of all, I just want to thank Bridget, the entire Northern California chapter team, Bridget, Dimitri, etc., for a great session today. Things seem to be going so well, and the sessions have been so compelling, so they really deserve a pat on the back for putting a great program together. So as I said, I'm going to talk to you a little bit about some of the things that are happening from an advocacy perspective, but I did just want to start by talking about the HIMSS mission and vision. So, I know you heard from our CEO, Hal Wolf, earlier today, but our vision and mission are really the foundation of everything we do at HIMSS. So I always like to start off all my presentations by talking about our mission and vision. So the vision at HIMSS is to realize the full health potential of every human everywhere. And our mission supports that, which is to reform the global health ecosystem through the power of information and technology. So I think when we're running through all of the issues that we're going to touch on today, I think you'll get a better sense about how we're supporting our mission and vision through public policy, through government affairs. So what does the HIMSS government relations team do? So you can see, I think we really can divide up our work into kind of 5 different categories. First and foremost, I think we are advocates, and we advocate directly as well as through our chapters. And then I think we also are analysts, and we analyze policy at the federal, state, and local level, provide information to our chapters, to all of our members about what's happening in different aspects with different issues. We're also a convener in terms of convening government officials, private sector stakeholders, and trying to break down the silos between different sectors, between different officials and policymakers to try to drive change. Also, I think we are thought leaders, and in terms of the analysis that we do create, I think we try to create white papers and other sorts of documents and information that can try to inform advocacy debates at the federal, state, local, and even at the global level. And then we also organize and train, and we'll talk a little bit about some of the work that we do through our chapter advocacy roundtable a little bit later on. That's one of the means that we use to try to organize and train our community of volunteers. And HIMSS does have a membership of well over 100,000, about 115,000 members worldwide. So organizing and training all those members to be up to date on what's happening on different public policy issues, as well as figuring out ways that they can make an impact on those different issues. So our policy priorities can really be divided up into 4 different buckets. So interoperability, the ability to secure exchange, appropriate and ubiquitous data access and electronic exchange of health information is one of our big policy priorities. Also connected health. And when we talk about connected health, we're not just talking about telehealth, although that's a big component of connected health. We're also talking about remote patient monitoring technology, as well as broadband and access to broadband across our country in rural areas, as well as other parts of our country. Cybersecurity, data privacy is kind of our 3rd category. That's ensuring the privacy, security of patient health information, no matter where it resides. And our 4th category is really focused on value-based care delivery. So this is something that our HIMSS Board of Directors has talked to us about over the past couple of years about how they want us as a public policy entity to focus more on value-based care delivery and make sure that we're prioritizing the delivery of higher quality and outcomes-focused care that leverages technology. So those are really our 4 kind of policy priorities in a nutshell. And a lot of the policy issues that we're going to discuss today really fit into those 4 categories. So to start off, I'm going to talk a little bit about some of the things that you have going on in California, because I think they're a great microcosm for things that we are trying to address at the federal level, and also things that other states are looking at and looking to California to really lead on and follow the example that California has begun. So California, a couple of years ago, passed a piece of legislation that really set to initiate a statewide information exchange framework, a health information exchange at the statewide level. So right now, by July 1st of this year, California is going to be establishing a single data sharing agreement with policies and procedures on data exchange. And that's going to govern the exchange of health information among healthcare entities and government agencies in the state. This is guided by a stakeholder advisory group that has been convening public meetings. And that advisory group is providing information to Cal HHS about the direction that they should take. So after establishing this single data sharing agreement, the idea is that the data framework will be established and executed by January 31st of 2023 for all acute care hospitals, physician organizations, and medical groups. And that also is going to include other healthcare facilities such as nursing homes, health service plans, disability insurers, Medi-Cal managed care plans. And at the same time as all of these provider related organizations are really going to be implementing this data exchange framework, Cal HHS is going to encourage as many county health, public health, and social services providers to connect to the data exchange framework. So the idea is that this is going to be exchanging health information in real time with all participating healthcare entities across the state. Full implementation of the statewide data exchange framework is going to be by January 31st of 2024. So the idea would be that all participating entities will be participating and providing access to their health information in real time for treatment, payment, and healthcare operations. I should have started out my presentation by actually reminding everyone that we'll have plenty of time, I think, for questions at the end of this presentation. So if you do have a question or a comment, if you want to try to use the Q&A box at the bottom of your screen, that would be best. And we will get to questions in just a few moments when I run through a few more issues. So on the next slide, the other important topic that we have been dealing with at the HIMSS level, and also several states have been trying to tackle, is the idea about maternal health issues. So California was really one of the first states to move forward with a comprehensive program to improve maternal and infant outcomes by enacting a Momnibus Act, the California Momnibus Act last October. The idea behind the Momnibus Act is to improve research and data collection on racial and socioeconomic factors that contribute to higher rates of maternal and infant mortality. It's going to institute several relevant steps, I think, to what we're talking about related to maternal health and improving maternal health. So what the Act does is codifies and strengthens the work of the Pregnancy-Associated Mortality Review Committee. And they're going to focus on investigating pregnancy-related deaths and make recommendations on best practices to avoid these preventable tragedies. There's also going to be work to improve the data collection in the fetal and infant mortality review process. And also work is going to be done to try to reduce paperwork requirements for pregnant women and extend Medi-Cal eligibility for postpartum people, making it easier to access CalWorks for pregnant people. So as I mentioned, what's happening in California is something that we're also trying to grapple with at the federal level. There have been several pieces of legislation in the US Congress that have been introduced related to maternal health and trying to improve maternal health. The Vice President Kamala Harris's office is very interested in maternal health issues, and she has instituted several steps. So this is something that is a real positive step from California that other states and the federal government are trying to figure out how to best emulate. So kudos to California for moving forward in some of these reforms. So now I wanted to just take a step back and talk about some of the issues that we're trying to address at the federal level. So folks will remember through the 21st Century Cures Act, that we have been working on implementing information blocking provisions, or as the Office of the National Coordinator for Health IT is talking about now, is really about information sharing provisions, about how to better share information. So you can see right here, what I have on the screen is a screenshot of how consumers, patients, hospitals, any sort of entity or individual can report an instance when they feel like their information has been blocked from being shared across the healthcare ecosystem. So it's a very simple, and I have the website at the bottom that folks can use to report instances of information blocking. This is a really key component in terms of this drive to try to better share information across the ecosystem. This has been up and running for the past several months. And on the next slide, I actually have a little information about the different claims that have been shared thus far related to information blocking. This is pretty interesting in terms of the claims that have been made against potential information blockers. So what's happening with these claims is they are being publicly reported, and you can see down below where you can get access to all the numbers. But this is information that was reported between last April, really when the act related to information blocking came into effect. Although there's no real enforcement component to this just yet. The idea was that information blocking is in existence. It can be reported on right now. So this is 274 claims of information blocking were reported during this time. And since I created this slide, since the end of February, there actually have been additional claims of information blocking that have been reported. So I believe we're up to 331 claims of information blocking. But who's making these claims are you can see on the right-hand side that patients are the vast majority of entities or individuals that are making claims of information blocking, followed by attorneys and healthcare providers, third parties, et cetera. And then on the left-hand side of the screen here, you can see that the claims are really against healthcare providers. There are 2 claims against health information networks, health information exchanges. There is not always enough information that it's going to that was included to try to identify specifically who is the potential actor under information blocking that may be blocking the information. But you can just get a sense of the direction that things are headed in terms of information blocking with this information. But again, there's no enforcement mechanism. So this information is really going to be used right now to try to inform future rulemaking, try to inform future information that will be made available to try to speed along and encourage more broader sharing of information. Another big topic that's related to interoperability that we have been talking about is the establishment of the Trusted Exchange Framework and Common Agreement, the so-called TEFCA. So what happened is earlier this year is the Office of the National Coordinator and the the recognized coordinating entity, which is the Sequoia Project, have published the Common Agreement and the Qualified Health Information Technical Network Technical Framework. So those are the 2 kind of foundational documents when we're talking about how TEFCA is going to be moving forward. So TEFCA really is a voluntary network for the sharing of information nationwide. It's being created as a part of the 21st Century Cures Act and being driven by ONC, the Office of the National Coordinator, and the recognized coordinating entity, as I mentioned, the Sequoia Project. So the Sequoia Project is serving as that umbrella organization that is really trying to provide the oversight and the governance to this entire new voluntary framework. So you can see the goals listed on the right-hand side of the screen about establishing a universal policy and technical floor for nationwide interoperability, simplifying connectivity for organizations, enabling individuals to gather their healthcare information. The idea, and very simply, there is some complexity to TEFCA, but the idea for TEFCA is that it's going to really be revolve around QHIN to QHIN exchange. And QHINs are those qualified health information networks. The QHINs are going to work with participants and sub-participants to gather their information and share different queries when information requests have come in to make sure that information is shareable and portable across the entire nation. You can see that there's a couple different websites that I included over on the right that have more information, and I'm happy to go into a little more detail related to TEFCA, RCE, QHIN, et cetera, as if there's time at the end of this presentation. I also wanted to talk about another form of interoperability. We're not talking always about clinical data interoperability. What we also are focused on is making sure that public health information is flowing appropriately. One of the things that we really have been focused on in the course of the pandemic is making sure that this public health information is available to try to better address COVID-19, the pandemic, and position us for addressing future pandemics. So we have really been talking to the CDC, talking to a lot of other partner organizations about how we make investments to modernize and interoperate federal, state, local, tribal public health systems to make sure that that data is flowing appropriately between all those different levels of government. We put together a report that really focuses on making that investment in the state, territorial, local, and tribal level transformation efforts. So we are right now asking for $36.7 billion over 10 years for these essential public health functions that focus on really trying to build up immunization registry reporting, syndromic surveillance reporting, electronic case reporting, and public health registry reporting, to just name a few of the modernization efforts that we have underway. So again, the idea is to make this investment at not only at the federal level, which the CDC is working with Congress and working with other parts of the administration on, but also to make sure that this investment flows down to other levels of government that really are on the front lines of dealing with the pandemic, dealing with other public health emergencies, and again, trying to make sure that, that they have the infrastructure in place to deal with future public health emergencies. The other issue that we are trying to address at the federal level is trying to figure out what the future path forward is on health data privacy and how to address health data privacy. So you can see on the graphic that I created here, health data privacy really has several other factors that I think are influencing where we are headed with health data privacy. I think one of the bigger ones relates to HIPAA and to changes related to HIPAA. Folks will remember several years ago, the Office of Civil Rights in HHS published a proposed rule related to HIPAA changes. That has not been finalized yet, but obviously that is going to have an impact on kind of future changes to health data privacy. There's also work at the state level, and California, again, is a great example in terms of the California Consumer Privacy Act, the CCPA, and some of the changes that you all have made, serving as an example to maybe some of the things that we want to consider at the federal level. And there are a lot of folks in Washington, D.C. and across the country that are looking at the CCPA and other state actions that when we think about what should be happening at the federal level. There's also the what's happening in the European Union and the GDPR, the General Data Protection Regulation, as an influence on what should happen at the U.S. federal level. And then, when we're talking about health data privacy, we're also just talking about data privacy in general across other sort of platforms, other sort of industries, other sort of markets. So that is also contributing, I think, to where we're headed for a future health data privacy interactions, health and laws and regulations that we should be looking out for. So it's something that we are definitely paying close attention to. So I wanted to talk to you a little bit about some of the things that you all as HIMSS members, you all as chapter members should be kind of thinking about. And there's really, I like to start off by talking about the importance of building relationships at the state level. It's really critical that we talk to, interact with, listen to officials at both the state and local levels of government. And there's a lot of folks, obviously at Cal HHS, from the secretary on down, that have an interest in health IT, that use health IT as an enabler to push forward other policies that they have underway. There's also Medicaid happening, Medicaid changes happening at the state level that I think are important when we talk about healthcare transformation, health IT, and so on. So talking to those officials, I think, is critical, again, both at the state and local level. Then there's also like-minded organizations that we should be thinking about, from other nonprofits, health information exchanges, academia. So those are all other potential partners that I know the Northern California chapter, the Southern California chapter, other state chapters have looked to for potential partnerships. And then there's also the opportunity to use me and try to leverage HIMSS staff and chapter advocates for resources. So you can lean on me for assets and subject matter expertise, some of those white papers and analysis documents that we've kind of put together. And also use the chapter advocacy task force as a potential infrastructure opportunity to build on. We have monthly meetings of our chapter advocacy task force. We have updates and we have opportunities for sharing lessons learned and model practices. So when we think about all the factors that are crucial to the success of an advocacy program, it really starts off with starting out with a strong voice. And that strong voice on a particular issue or a set of issues around healthcare transformation or health IT builds kind of, I think, into a respected source, and then a respected source to some of the legislators in Sacramento, and also state officials in Sacramento, and to becoming a trusted collaborator with them. And once you become a trusted collaborator, there's opportunities for making a policy impact. And that policy impact can be felt at the state level as well as the federal level, and those build upon one another. So that is my my presentation. I'm happy to kind of take any questions or dive a little bit deeper in the last few minutes to anything that folks want to hear about. But I really appreciate the opportunity to speak to you all today and to be part of such a great program. So if you all have any questions, please feel free to add them to the Q&A section of the platform here. I know we just have a couple minutes left. I just provided kind of a brief presentation. I could talk for hours about all the different policy issues that we really focus on at HIMSS. You know, I mentioned our 4 different categories or policy priorities, and most of the issues that we kind of think about fit into those different areas. One of the big things that I didn't have a chance to touch on just yet really relates to telehealth and what the future of telehealth is going to look like once the public health emergency ends. California, I think, is one of those states that has kind of put forward an extension of the opportunity to use telehealth that some other states are following. At the federal level, we are still trying to figure out what's going to happen to the telehealth flexibilities that have come into place with the public health emergency, and what happens to those when the public health emergency eventually ends. The schedule that we're on right now looks like that telehealth and the public health emergency will be renewed one more time at least, is the kind of current trajectory that the community is seeing as a through probably July of this year. Right now, we just actually renewed the public health emergency a week or so ago, and that's going to run through July. And then July would be another 90 days. And then at the end of that 90 days, we will be looking at hopefully some sort of legislation, some sort of regulation that will kind of make sure that there is a greater flexibility for the use of telehealth moving forward in the Medicare program, which should translate to a broader, broader possibilities down the road. So a couple questions that we have here really quickly. Have you found legislators open to meeting on Zoom? So I think that is a very good question. And I think by and large, the things in Washington, D.C. have been opening pretty slowly. So I think legislators and their staffers have been very open to meeting on Zoom. So building those relationships that I mentioned before, a little more challenging, I think, as folks have probably found meeting virtually. But I do think that it's an opportunity to start those conversations, continuing those conversations, and maybe in person after we get back to some more sense of normalcy. But I would not hesitate to reach out to the legislators, to their staffers, and try to find an opportunity to begin conversations with them over Zoom, and then look to continue them down the road as things move forward in person. The other question has to do the security of equipment technologies. How has that been addressed? And HIPAA focuses, does not really have any policy for technological equipment not to damage patient health. So we do, I will say that I think this question is more geared towards HIPAA and what's happening. And a lot of the changes that we have been talking about related to HIPAA have been focused on kind of the HIPAA privacy rule. There is also the HIPAA security rule, which does not receive quite as much attention, but there are a lot of cybersecurity best practices that are being put into place from the National Institutes of Science and Technology, NIST, that are recommendations for the federal government, for other entities across the healthcare ecosystem to use in terms of instituting the best cybersecurity practices. And I know that some folks from the Department of Homeland Security have been participating in this conference, and I know that they have a lot of recommendations and a lot of best practices that they're trying to share related to best practices around best cybersecurity practices and hygiene moving forward. Yeah, so the last question has to do with broadband initiatives in rural parts of the US. So I will say that there was a big push as a part of several of the COVID relief packages to make sure that that broadband was available and accessible to rural parts of our nation. So they the federal government made grants available to state and local entities of up to $65 billion. Those dollars are actually being sent out to states and localities right now. This was in the most recent infrastructure package that was passed in November of 2021. There was $65 billion that was included for in the infrastructure package for broadband, including broadband across the nation. So that's something that we are watching very closely. I can try to get some more specific information on how the dollars are being targeted in California and send it along to Dimitri and some of the other folks at the Northern California chapter. So it looks like we're just about out of time, so I will conclude there. But again, thank you so much. More information about the Northern California State HIT Day and partnerships that they are embarking on with the Southern California chapter as well on a State HIT Day. Those will be forthcoming very soon. But again, thank you very much for your time today. I really appreciate the opportunity to participate in this conference. And please don't hesitate to reach out with any sort of specific questions or comments or ideas of things that we should be doing at HIMSS. But thanks again for your work on healthcare transformation. We definitely appreciate all the work that's happening in Northern California, as well as other parts across the US and the globe. So thank you.